Welcome to episode 2 of the Health Babes podcast. I'm Dr. Becky Campbell and
Yeah.
co-host
Dr. Krystal Hone.
So today we are going to talk about histamine.
Yes.
It is a huge topic right now, and so many people are realizing that they're dealing with this. And this is something that I have, and Krystal, you have dealt with this too.
Absolutely. To some extent, right? Everybody has some form of, I feel, histamine intolerance.
Yeah.
Don't you think, the more that we in practice?
Yes, I do. And it's funny because I was talking to JJ Virgin the other day, and she goes, "How many people have histamine intolerance?" And I was like, "Everyone."
Yes, to an extent, absolutely. So yeah.
I mean, and I don't really mean everyone, but I think that so many people have it and just don't know because, it's really this thing where you don't feel well, you have this, these wide range of symptoms and your doctor doesn't know what it is. And again, as we said in the last episode, you leave with a prescription for, antidepressants. And
Yes.
unfortunately, it's not talked about a lot yet. I think more people are talking about it. I certainly talk about it a lot.
Yep.
And our audience will definitely want to hear about this. So we're going to kind of have Krystal just ask me the main questions about histamine intolerance. And I go through that to educate you. We didn't really do a post asking you guys on this, but I know that this is what everybody wants to hear. Probably.
Absolutely.
So we're just going to go through and give you guys the main points of histamine intolerance and kind of help you to identify this in yourself.
Yeah. So why don't we start off back with at least what is histamine? Let's do that.
So histamine is a chemical that our body, we make in the body, and we also ingest. It's in food. Histamine is not a bad thing. Histamine gets a bad rap because you hear the word antihistamine medication. And so you would assume that you don't want histamine in the body, but it has a lot of really important jobs. So one of the jobs of histamine is to cause inflammation in our body. If our body senses that there is a pathogen there, and that allows our white blood cells to come in and kind of find the pathogen and do its, the immune system to do its job to get rid of it. And, it helps with our stomach acid, which is extremely important for digestion. And it's a neurotransmitter. So it helps our body talk to our brain. And it's very involved in the brain, actually. So that's why you see a lot of symptoms of histamine intolerance tied to the brain, like insomnia,
anxiety, things. Yeah.
Yeah. So the problem is actually not histamine. The problem with histamine is that when histamine is done doing its job, it should be broken down, and there are different enzymes that do that. The main enzyme is called DAO, which is predominantly made in the gut, and that enzyme will come in and it will break down the histamine and get rid of it. But unfortunately, because there's such poor gut health these days,
true.
Yeah, and so many other factors that lead to the reduction of that DAO enzyme, whether it's genetics or medication or, vitamin deficiencies, whatever it is. So a lot of us aren't producing enough of that. And so we can't break down the histamine enough, and then it's left out. And we have histamine receptors all over the body, and it's getting into these receptors, and then it's causing these symptoms that people have.
Yeah. Talk to the listeners a little bit about the bucket that you talk about so much in your book, and some of the things that really overflow our buckets.
Yeah.
Because you talk about how it's not, exactly. Yes. So some of the things that really drive that bucket to be, to overfill. So let's talk a little bit about
So
that.
this is a really good way to think of what's going on. So let's just imagine that you have a bucket, and there's all these things filling this bucket that are causing your histamine in your body to get higher and higher or not be broken down. So that would be like gut issues, environmental toxins, nutrient deficiencies. Stress is a very big driver.
Such a big one. And people don't take that one as serious, right? And we do get a lot of the stress management techniques. And right, wouldn't you say that, a lot of people don't take it as serious as what they should?
Meditate, they'll take 72, supplements and eat nothing, but they won't meditate.
Right.
So it really all matters. And that's, something that we talk about a lot. But that hormone imbalances, and a lot of people are estrogen dominant these days, and that's because of all the products that we use have these xenoestrogens that are raising our natural estrogen levels, and estrogen drives histamine in the body. So all these different things are making us release more histamine. They're making us not able to break down histamine the way that we should. And so what we do in the practice is
Yeah.
we look for all those things that are filling your bucket. And that's what we do testing for. We look at your hormones, we look at your cortisol, which is your stress hormone. We look at your gut health to see if there's any bugs. And some of these bugs actually create more histamine in the body.
Right.
So we look at all these things. We look at the foods that you're eating to see if they're high in histamine. And what we try to do is empty that bucket out. So
Exactly.
that's kind of the goal. And that's what we do with our patients. And so we get the bucket as empty as we can.
Mhm.
And that's when people can start to reintroduce more high histamine foods and,
Mhm.
not feel so restricted, because that is not our goal. We don't want people to
Yeah.
feel such a restriction, but
Mhm.
we do want people to understand that you do need to eat the foods that your body likes. And that may vary. You may be on
Mhm.
vacation and you have no stress
Exactly.
to be able to eat guacamole to the cows come home.
Exactly. The avocados is hard for people, isn't it?
Because they're high
It-
in histamine and everyone wants to eat them, including myself. And then you may be back home and you're really stressed out in your job, you're having issues, or you're having issues with your spouse, whatever, and you try to eat an avocado and you get a migraine immediately.
Exactly.
Yeah. So
I
what we do, with our patients is we try to get people to be very aware of what does your bucket look like right now. Like, we've worked on all this stuff, but what are your stress levels right now? So is this a good time to add back high histamine foods, or is it not? And that's why the diet kind of varies a little bit with what you're going through, basically, and how that bucket is looking.
Right. Let's talk about some of the foods
Mhm.
that are higher in histamine. Yes.
First of all, I want to show you guys
She
the
has an amazing list in her histamine book. That is just so thorough. Yeah. The four phase.
that plan. But I wanted to make a list, and it is a yes, no, maybe list, because
Mhm.
I want people to try to eat as much as they can and not feel so limited. So
Right.
the plan here is we do this in phases. And we, start with eliminating the no foods. The no foods are the foods that are really high in histamine, like fermented foods. Fermented foods actually have bacteria that creates histamine, and
Exactly.
and that is why people struggle so much with fermented foods. And people who don't know they have a histamine intolerance, will be told to do, and I'm not going to call it any specific diet, but a diet plan
Right.
that's, and a lot of these diet plans are very high in fermented foods because they have extreme nutritional value.
Yes.
And so they're doing what they are told to do, and they're getting sicker and sicker, and that's because they don't know about this histamine picture.
Mhm.
So fermented foods, avocados, dried fruits, anything aged, the longer
Mhm.
food sits out or sits even in the refrigerator, the more of that histamine producing bacteria builds on that food. Um, and so that's why, we talk about freezing your food and getting
Yeah.
fresh food. And, some people will tell you not to eat meat because there's an amino acid called histidine in meat that breaks down into histamine. But if you get really fresh meat, and
Mhm.
you're eating, maybe 3 ounces, 4 ounces of meat, and then a bunch of vegetables, that you should be fine. It's usually not the issue.
Mhm.
It's more, what the food is, and strawberries, which is surprising.
Right. It's so sad, but
Yeah,
it's a big trigger for a lot of people. Yeah. Yeah.
and some spices too, like cinnamon. That's why in my books, even though I use apples and a lot of things because they're actually an antihistamine, I don't use cinnamon with it because some people do really bad with cinnamon.
Mhm. And
So
don't you find everybody is so different too with their reactions with histamine food? So that's why when we work with our patients, we have them log their symptoms with the tracker and things like that so that we can help them best because everybody is different, especially with reintroducing after you fix some of these drivers, right?
So true. Everyone's different. Sometimes people are like, I'm fine with that food. That food doesn't
Yeah.
bother me. Whereas someone else is just they're on, death's door if they eat it. So
I know. And everybody, we have some really sensitive patients, and it just takes time as you really get to some of these root causes, especially if they're dealing with mast cell, right? Because
absolutely. And there are different levels of histamine intolerance
it
and
really is.
syndrome, which mast cell activation syndrome is the biggest driver of histamine intolerance. And it's basically mast cells are these white blood cells that
Mhm.
produce histamine or release histamine. And with mast cell activation syndrome, they're either producing too much or they're releasing it too easily. So
Mhm.
whereas something you would, if you would only release histamine when there's a real threat, like I talked about earlier, the pathogen being there with people with mast cell activation syndrome, they may smell perfume and
Yeah.
start dumping histamine. So,
Mhm.
um, there's just different levels. Some people are extremely sensitive, and I've been all of the levels. So,
Yes, you really have. You've been through it personally. This is why you're helping so many people. And even with the book, it's amazing. And it's still new, I feel. Still
very,
new, very new. So yeah, it's a lot. It's very complex, that's for sure, and what we found in practice.
yeah.
Let's talk about some of the testing with histamine intolerance, or some of the testing that we do too to help our patients.
Yeah, so we use we like to look at what's going on with the gut. We use a stool test from Precision Analytic. No,
Mhm.
that's the Dutch,
No, that's the Dutch. Yeah, the GI map.
the GI map we used
Mhm.
for the stool, and also Doctor's Data. They're both good companies we
They
like.
really are.
But they're looking at yeast, bacteria that shouldn't be there, bacteria that should be there, and parasites and stuff like that can drive this H. pylori, which is a bad type of bacteria that a lot of people have. And they're all big drivers of histamine intolerance. So we like to kind of see what's going on there, address that, give them a protocol to kill all that stuff and protect the lining of the gut. This test looks at leaky gut, which is extremely important when
It is.
any type of food sensitivity.
Right.
Um, and then we do the Dutch test, which is looking at the sex hormones. Estrogen is very involved. Low progesterone and is also very involved because progesterone it can help you produce more DAO, that enzyme that breaks down histamine. So we like to look at the balance of that and make sure that we can help them to balance that out. Cortisol is a big driver,
Yeah.
and that's that stress hormone, which activates our sympathetic nervous system. So our sympathetic nervous system is our fight or flight nervous
Mhm.
system, which we want to have active when someone is chasing us, but we don't want it active when we're trying to rest or, do something calm and not be feeling nervous and anxious. So that's really activated. And when you activate the sympathetic nervous system, your body then produces more mast cells and then you release more histamine. So, all those things are really tied to it. And so we like to look at that. We like to look at blood.
Yeah.
Um, and
Nutrients.
yeah, looking at nutrient levels, vitamin C, copper,
Yeah.
but B6, those are all very tied to, deficiencies in those are tied to histamine intolerance. So we look at that. We just try to really look at everything we can. We look at to see what the thyroid function looks like because the thyroid issues can drive histamine intolerance as well. And histamine intolerance can drive thyroid issues. And we've
It's true. Everything is so connected, right? And so making sure you're getting all the pieces of the puzzle. So that's where,
and
yeah,
we've
the testing is amazing.
patients with both those issues and me. I mean, I have Hashimoto's and mast cell activation syndrome. So it's common. So that's what we do. And we really try to empty the bucket and get our patients really stable. And
Mhm.
we do it with supplements. We use, quercetin, which is a natural antihistamine. Uh,
Yes.
we have a blend we use called Histo Relief, and we support the liver, which
Liver.
extremely important because people with histamine intolerance tend to be bad detoxers.
Mhm.
They don't push stuff out well, which is why they tend to be so sensitive. And a lot
Mhm.
of times they can't even handle supplements or food. They're very sensitive to everything. So I find that starting with liver support, and I do talk about this in the book, the different ways you can support your liver. But starting with that is really important with that, and with the taking the major high histamine foods out, and we just kind of go from there.
Exactly. Yeah. So you will even have some patients, because you know how even with testing for mast cell activation syndrome, it's not necessarily, it's still new and there's still a lot of research out there, right? So like specific markers for mast cell, it's not as specific, right? It's not as easy as, yeah.
There are specific markers, and I actually
Right.
list all of them in the book. But the problem is that tryptase is an example. This
Right.
um, it can be, you have to be reacting.
Exactly.
It's not. It's if you're going, and everything, you're feeling fine, and you go get that, and they say, "Oh no, it's not high. You don't have mast cell activation syndrome."
Exactly. It's just not as specific. It's
Yeah,
still very new and there's not, so that's where it's so important to focus on these drivers, right? Such as gut infections and hormones. And then even, oh gosh, Beck, like heavy metals and mold, right? With
right.
histamine.
Yes. Let me
Oh,
tell you, mold is literally the biggest driver in my opinion. And
yeah.
a couple years ago, I was
Really?
fine. Yeah, I was fine, and I was doing great. My health was great. I felt great. I had some stress, was
Mm-hmm.
but besides that, I was living in mold, and I had no idea. And I can smell mold from a mile away.
Mm-hmm.
And I was literally sleeping on top of it. It was coming in. There was a bursted pipe under in the flooring under my bed. It was coming up through the carpet, and
Yes.
the picture underneath the bed, so it was like kind of holding it all there.
Mm-hmm.
But I was waking up feeling like I drank 20 beers or whatever.
Yeah.
And I couldn't drive my kids to school. I literally couldn't function.
I remember when you went through that.
It was
I,
terrible. And it was
it,
months. It was
yes.
months. And I did every test on myself. I didn't think it was mold because I knew I smell mold easily. I
Mm-hmm.
never
Mm-hmm.
smelled it. And
Mm-hmm.
I even had my breast implants removed because thinking
Yes.
breast implant illness.
Mm-hmm.
About 2 weeks after I had my breast implants removed, I had moved into another room while I was recovering from that, and I felt so much better. And I was
Mm-hmm.
like, oh, it was that I had that. And then I realized there was mold. We actually went to get a new bed, and when we moved the bed, we were like, whoa. I mean, the smell really came out.
Mm-hmm.
And yeah, and so it was that. And so anyway, and I can't tell you how many of our patients are living in mold. And I say to them, I'm like, listen to me.
Mm-hmm.
You are not going to feel 100% unless you get rid of
Yeah.
mold.
Yeah, and remediate it.
It's really important. So yeah, I would say that's probably the number one trigger for mast cell.
Mhm. And a lot of people just don't realize it too, right? And it's different in state to state, like Florida, for example, it's so humid. So the water and the mildew, and it's so easy to grow. Even California, I mean, my mom went through, the whole mold. It was a nightmare, an absolute nightmare. And then it gets scarier too, because not everybody, it's a costly thing too, right?
And
Having to leave your,
yeah, people don't want to deal with it, and
yes.
we'll put it off for a while. And I noticed this, but it's literally ruining their lives. And
I know.
it's sad, and it is expensive. I mean, sometimes, and you have to find the right person to find it, because
Right.
we had people come in and they were like, did they just tested the air quality? Well, mold can be behind your walls.
Yes.
They need to look in your air ducts behind your walls. They need to look everywhere. And if they're not willing to do that, they're not the right company. And I've had patients who say, well, the first company didn't find it, and I'm like, well, where did they look? And they tell me, they say, you need another company, and they will get another company. And they're like, they found it everywhere. I mean, my whole house was infested with it, but it was all behind the walls.
Right.
Big remediation project, but it's worth it. And I have a patient who recently, she went through the remediation and she did do the work, and she's like, I'm a new person. I feel so much better. And
Yeah.
we did a 2-month mold protocol just to make sure it was out of her body, because I had tested her previously for mold
Right.
in her body, and she did have it. So that's when I was like, you really need to get serious about this remediation. And she's a different person, and she feels amazing, and she can eat what she wants. She doesn't have histamine intolerance anymore.
Right, right. And I feel too, like, especially being in practice longer now, right? We see so many people, everybody handles it differently too, depending on where they're at in their health. Because I mean, because we are exposed to mold outside and all of these things, right? But I mean, there's certain people, like just even genetically, right? You just can't handle this. So you have to look into that and take it seriously to really take your health to the next level and help yourself. But
It all
it's
depends
scary.
on how well you push toxins out.
Right.
Genetic mutations that have to do with that, and liver function stuff. So that's why we always work on all that stuff, because if you are, I'm that type of person. I hold on to everything because of my genes.
Yes.
So,
We're the same. Me and Beck are the same, aren't we?
gene mutation,
Yes.
everything. But we
Yes.
have to support. We have to use liver support. We have to use glutathione. Like, we have to do all that stuff. And when we do, we're great. And when we don't, it starts to come back in because our body just doesn't do it well on its own. So
Right. So after, when we work with patients, this is something to talk about, reintroducing. Like, a lot of patients will say, oh my goodness, do I have to stay low histamine forever? Let's talk a little bit about that, because I think that's important.
So I think people are very quick to try to reintroduce. And
Yeah.
we put them on about a 30-day supplement and food plan while we're waiting on their testing to come back. And they think it's like a 30-day thing. And they're like, okay, well, I did your plan and I felt really good. And then I started eating the way I was because the 30 days was over and I felt bad again. I'm like, whoa, this is not it. No.
Yeah.
So, you have to really address the driving factors to be able to get to that point and let your body heal, to be able to get to that point to start to reintroduce. So once you are there, I recommend, eating a food and only trying one at a time, that has been a problem for you in the past, and eating that food for a few days in a row. And if you do well every day with that food, you're probably okay with it. And then you may find foods that you do okay with to a certain level. Like, you can go here, but you can't go here. So that's how I am with avocado. Like, I can't go free for all with avocado, but I can definitely eat it. Whereas before, I couldn't even look at an avocado without getting a headache. So that's kind of how we do that. And I say to people, just be very aware of your stress levels. Like, if you're stressed, this is, maybe keep your diet lower in histamine. And if you're doing really well and you're really happy and things are great, then you can probably push a little bit further. But there are certain foods that I never want people to eat. Like, I never want people to eat gluten ever. There's no nutritional value in gluten whatsoever. And in many people, it causes leaky gut, and leaky gut causes sensitivities to food. It causes autoimmune disease. It's a nightmare. So I just
thyroid, gluten and thyroid.
Yeah, exactly. Yes.
Mm-hmm.
And then there's some foods like dairy that I might say, okay, why don't you get raw dairy?
Like a good or better quality.
You know what I mean? And sugar, like, do like a coconut sugar or a maple sugar or something like that. But not all the time. And, in this book, I did give recipes like that because I didn't want people to feel so, like nothing to eat, but I don't eat the apple bread every single day.
Exactly.
I think it needs to be in moderation because sugar is sugar regardless. And nobody does well with a lot of sugar. So,
well, even when patients go, are staying away from low inflammatory foods and limiting their grains and dairy, they start to make a lot of those yummy grain-free, you know what I'm saying? Like the sweet treats, and they go overboard and they're like, I don't know why my gut hurts. Well, you just ate a pound of almonds. You know what I mean? You can go crazy with it. So you definitely have to have balance.
Yeah, that's true. Yeah, it is. And unfortunately, I see these posts and stuff on Instagram, and people are like, I hate when people say it's not a diet, it's a lifestyle and stuff. But it's true. You can eat whatever you want. That's, food that's full of chemicals and full of, trans fats and, all this crap that's in this food, whether it's high histamine or not, and expect to be in good health. You can't. So It is a lifestyle to a certain degree, and it's not all foods that you have to never eat again, but it's, you know, I like to just keep it real food, like have it
Exactly.
whole foods to keep it
Yes.
on. And there's so many resources now. There's so many companies that make
Oh, yeah.
paleo foods and um, you know, just so many ways we can find recipes, you know, Pinterest and, you know, it's, to me, there's really, you know, not a huge excuse, and it can depend on economic status for sure. So
Absolutely.
not that everybody has the same options, but I'm talking about the people who do have the option.
Right.
Have to, you know, decide that if your health is important to you, you're going to listen to your body and you're going to eat the foods that your body likes, and you're going to stay away from the foods that your body doesn't like. And if it doesn't like it and it tells you, then just know you're going to probably suffer when you eat that.
It's true. It's true. I know. This was good. People, I think everybody's going to really understand and know where to start if they're dealing with a lot of histamine symptoms. And yeah, I think this was good.
Yeah, so I have a histamine guide
Mhm.
where it's basically a quiz that it asks you some questions to see if you probably have histamine intolerance, and then that leads to like a PDF that kind of tells you what to do. It gives you a breakdown of basically what we've talked about. So we'll put that in the show notes. We'll link that for you
Mhm.
guys. We'll link the book so you can you know, look at that. And we have tons, you know, on drbeckycampbell.com, we have tons of
Yeah.
articles and everything, just kind of connecting all this together. So
Yes.
yeah. So, well, thanks for listening, guys. And this was
Yes.
episode 2. And
Yep.
we'll be back soon with episode 3.
All right. Have a great day.
Have a great day.